story. Here's the deal. I started down this journey of trying to educate people on health and wellness after I had originally started a journey of trying to be a successful professional businesswoman, healthcare provider, all of those things. And I spent decades in the business of healthcare, and years passed by, years turned into decades. So that's what happened. And when I decided to jump out of it and do this thing on my own, it was a little scary. It was a lot scary. And I didn't really know how people were going to receive me. So I did a couple of YouTube videos. I'm not an expert by any stretch of the imagination on social media. Did it anyway, and the results were very small. I had very few people, saw my videos and responded positively, and I just got a little bit discouraged. I started watching other people and I'm thinking, wow, they're extremely successful. They're doing all these things. What is wrong with my videos? And after a while, I just gradually stopped recording them. I stopped recording them. And I had to take a little time out, just a little mental break from adjusting myself to what felt like rejection. If you're putting out information that you think is helpful to people to get their health on track and all those wonderful things, you want to know why is this the results? What's going on? And it's a little bit of a sting. I know all of the motivational words that say don't care about what other people think, but if you're human and you have a pulse, you're going to feel the reaction a little bit if you think you're giving people something that's helpful and you don't get a reply. I had to make a shift in my thinking. So when I took the time out, my thinking is, now I don't care. You can listen or not listen. I'm just giving the information that I know is factual information and that I know worked for me with regards to my health and all of the things that I've seen in the years of working as a healthcare provider. I know all the things that don't work, and I'm just sharing this information. The information is here to share. It's up to you if you choose to take my information and try it and use it, or not, throw it away. That's not working for me. I'm going to continue to share my information. I started talking about the problem with how we're marketed in the industry with regards to sugar and all the products that have all these addictive substances in it, and how that is connected to the business of healthcare, and how people are being harmed in exchange for profit to other people. So the industry, we can talk about that top 1% that makes all massive amounts of money off of selling things to all of the people below there and in the middle, and how they strategically market to us with things that they know are going to be addictive and know that it's going to result in you spending more and more money on those products. And in connection with the healthcare industry, it's also contributing to you spending more and more money into healthcare. That's the message. I've seen it. I've got like 30 years of working in this whole healthcare industry because I'm retired from being a registered nurse. Seen everything. Worked in the offices, worked in the hospitals first, where the patient care, and you know what that problem came from. And then working in the offices that create the policies and the regulations that manage it, where you know the political component that is connected with this stuff.